Hey everybody, what's up? I have a massive headache. I have just been sitting in my office writing this paper on posterior impingement syndrome. And in order to write this paper, I have to look at what people are saying. And it's very interesting to me, although I got a friggin' headache, but it's very interesting to me because, if you follow me, I'm a totally different animal. I'm an outlier. I don't do things the way I'm supposed to, honestly, I don't read research. I don't follow anybody. I don't go to courses so much. I literally and the reason why is because it's an intuitive process for me. And that's maybe different. That obviously, sounds very different than the way we were trained, but I don't care what everybody else is saying, and no disrespect to anybody else, but I have to see it work. You know what I'm saying? I don't care what a paper says. I have to see it happen in front of my eyes, and my patients get better. You know what I'm saying? Or out of pain immediately. And I like to find it on my own. It's just almost like a detective, in the clinic is what's causing this, and I try this. But having said that, that's the way that I do it. And I realize, like I said, I'm an oddball, but I'm reading all this stuff, and all these people, this person says this and this person says that, but he cites this and he cites this and that, and it's just it's like a freaking Venn diagram, and I'm just sitting there and I'm just what on earth, I can see why everybody gets confused about what to do, because there's no consensus, and what's most interesting to me is that generally people don't tell you what to do. It's just we believe that this is, causing this condition, or here's an analysis of the analysis of the analysis. But what do you do, man? This is a hands-on profession. This is what do you do? In business, it's you go to a course and they're here's what you do to increase your bottom line, right? In research, I don't see that so much, when my SI, when I thought about publishing my SI protocol, I heard on certain terms that the SI joint doesn't move, the science is settled, you're crazy, right? But results prove what's true. So I published, an evaluation method and a 4-exercise protocol that disproved what they were saying. The results prove what's true. And that's what I find that's lacking, is that nobody generally tells you what to do, do this, X, Y, Z, replicate that, and, you'll find, X amount of people get better, Anyways, I just find this to be a fascinating process. I don't mean to offend anybody. I can see how you can get lost in this research world of and I also can see how you reading it makes you feel a lot about it, but the question is what do you do to get the person better? You know what I'm saying? What do you do? A verb. What do you do? What exercises? What stretches? What joint mobilizations? What's causing it? You know what I'm saying? And that's what I'm focusing on. And maybe people just don't want to publish, like I do. I realize it's a lot of people say to me, Ryan, why are you doing this? Publishing all this stuff. But, I'm trying to help people. And, maybe just people just want to make money on their courses. I don't know. But I just find the whole thing fascinating. It's been a fascinating experience for me. Anyways, I'm going to write, I'm going to write up, other protocols in this paper that I use for shoulder issues, as a guide for people, because I want people to help other people physically get results, and these, a lot of these things work for me 99% of the time or more. So anyways, it's just been fascinating. I'm going to go relax because I got a headache after reading dozens of articles about people speculating this and that, and some people say this, and it's crazy. Anyways, I could see how you can get lost in it. It's just really not my thing, which is strange because I write papers, which is strange because I said I would never do that after I took that class in college. So anyways, life is very interesting in my world. But anyways, I'll get this out and you'll be able to read it at some point. All right, peace. Love you all.